So, I am here to discuss a lecture on National Leprosy Control Program, National Leprosy Eradication Program. In this program, we will discuss about the vision and mission of this program, the treatment strategy, what are the infrastructure. So, we will discuss on all of these points. Yes. So, we will start with the NLCP, National Leprosy Control Program. This was launched in India in 1954 to 1955, and after this there is a multi drug therapy, because there are the chances of the resistance in treating the leprosy is there. So, for this this multi drug therapy is implemented, and this came in 1982. Okay. After this multi drug therapy, there is a revision in this National Leprosy Control Program, and we made another program, National Leprosy Eradication Program, with the help of this MDT. So, this National Leprosy Eradication Program was introduced in 1983. Yes. What is the strategy of a National Leprosy Eradication Program? It was based on controlling the disease. Okay. Leprosy is a skin disease, means where the skin or nerves are involved. Okay. So, we are controlling the disease through the reduction in the quantum of infection, okay, in the population, reduction in the infective sources, okay, and breaking the chain of the infection. Okay. So, the program was initially taken up in the endemic districts, because that was on the pilot level. Okay. So, the most target means most effective target was at the time was to implement it in the endemic areas. Then we have extended it to the other districts as well. Okay. So, we have extended it from 1933 to 1993 to 1994 with the World Bank assistant with the funding of this. Okay. Now, under this we have 4 research training institutes which are working. They were established directly under the this DGHS, okay, General Health Services, namely Central Leprosy Training, yes, Research Institute, CLTRI, this is one of the institute, then Regional Leprosy Training Research Institute. Okay. After this, in addition, training center was established under the ICMR. Okay. What is the mission? So, mission is leprosy free India. This is the vision, and then after the vision there is a mission. Okay. The NLP, National Leprosy Eradication Program mission, is to provide quality leprosy services, okay, diagnostic facilities, treatment, infrastructure of the labs. Okay. They are all taken in these quality leprosy services, free of cost to all the sections of the populations, okay, the vulnerable population, with easy accessibility through the integrated healthcare system. Okay. So, this is the mission. What are the objectives? So, see the objectives. We have to reduce the number of cases, okay, less than 1 per 10,000 population, yes, at subnational and district level. Second objective is to reduce the grade seconds disability. In the leprosy we have some grade disability. Okay. So, grade 1 means there is a eye problem, but vision problem is not there. So, that is of grade 1, but in the grade 2 what we will see, there is a abnormality, we will see functional abnormality we will see. Okay. So, in grade 2, like there is a eye infection and vision problem is also there. So, that is the grade 2nd disability, means the functional inability. Okay. So, to reduce the grade 2nd disability, we have set what the target is, less than 1 among new cases at national level. Okay. Then to reduce the grade 2nd disability cases, less than 1 case per million population at national level. Okay. So, these are some targets. After that, 0 disability among new child case. Okay. if any child is suffering with leprosy, there should not be any disability. This disease is also associated with stigma and discrimination in the society. So, we want to achieve the zero stigma, okay, by spreading the communication regarding the disease. What are the strategy? How we will achieve this? These objectives what we have made in the National Leprosy Eradication Program. So, we can integrate our services through general health care system. Okay. We can go for the early detection of the cases, okay, complete the treatment of the cases which are confirmed with the leprosy, okay. Then identify the cases by contact tracing as well, okay. So, carrying out household contact survey, okay. Then involvement of accredited social health activists, they are playing a very good role in the society for making any program to be successful, okay. So, they will help the ASHA workers in the detection and completion of the treatment of leprosy cases on time, yes. Other strategies, strengthening of disability prevention, okay. So, I told you if there is a infection, it should not convert into functional disability. So, we will try to control the disease on the previous levels, okay. So, strengthening of disability prevention and medical rehabilitation services. After that, spreading the information regarding the disease, okay, the compliance. So, information, education and communication as well as reporting of each and every case, okay. So, this is under your IEC. After that, intensive monitoring and supervision and health and wellness centers, okay, at primary health centers, community health centers, sub centers, district level centers, okay. Now, salient features. So, see what are the salient features here. This eradication program, leprosy eradication program, this is centrally sponsored scheme, okay. So, funding is given by the central government. Now, it is under your NHM, National Health Mission, okay. National Leprosy Eradication Program follows decentralized health planning and funds are sent to the state level as well, okay. So, from the central areas, they are spreading it on the state level as well. Now, quality of services and sustainability is the main focus, okay. Whatever the drugs, diagnostic testing facility, they should be of very good quality and we have to maintain it, so that we can prevent the disease, we can prevent the transmission. We have to reduce the disability prevention and medical rehabilitation, we have to do this prevention, provide the medical rehabilitation, it is on the top priority, okay. We have to remove the stigma and discrimination, which is the part of this strategy and the salient features under the National Leprosy Eradication Program. What are the drugs used? So, see in this we are using MDT, okay, multi-drug resistant therapy, multi-drug therapy, yes. So, multi-drug therapy we are using rifampicin, we are using clofazimine, we are using dapsone, okay. Apart from it, there is a thiamides, fluoroquinolones, minocycline and macrolides are also used if these drugs are not effective or showing the resistance. So, now see treatment of single skin lesion SSL of leprosy. So, how we will treat? We are using ROM therapy. Under this, R means rifampicin 600 mg, okay. O is ofloxacin 400 mg and minocycline 100 mg is used, okay. So, this is also one combination we are using for treatment of leprosy. Now, leprosy is of two types, on broad classification we will see. So, it is of two types, paucibacillary and multibacillary, yes. Now, in the paucibacillary, the microbial load is low comparatively to the multibacillary. Nerve involvement is less in paucibacillary as compared to the multibacillary, yes. So, the treatment of the paucibacillary is for the 6 months, okay. So, the combination which we will use for the treatment of leprosy, it is only for 6 months for paucibacillary, where the microbial load is less comparatively to the other type of leprosy. In the multibacillary, we are using the treatment for 1 year. Okay. So, duration is different depending on the class of leprosy. Now, infrastructure, norms and SET center under National Leprosy Eradication Program. Okay. So, in the infrastructure, what we need? SET center. Okay. SET center is the Survey, Education and Treatment Center. Okay. So, you will see the population norms. So, one SET center per 20,000 to 25,000 population. Okay. Then there is a urban leprosy center in the urban areas. So, urban leprosy center is 1 per 50,000 population. Okay. Leprosy control unit, okay, it is 1 per 4 to 5 lakh population. Okay. So, they are managing the other leprosy centers under means they are which are in below of hierarchies. Okay. So, they are managing the leprosy cases, they are reconfirming the cases, okay, checking the data. So, this is how the leprosy control unit are working. So, first of all we will discuss about the SET centers, survey, education and treatment centers, which is per 20 to 25,000 population. They are attached with primary health care in the rural areas. Okay. So, this we are clear, SET is in the rural area. For urban areas we have ULC, Urban Leprosy Center. Okay. After that, in the SET, administrative control is under the medical officer, okay, of the primary health care center. Population catered we have already discussed. What are the staff? One paramedical worker will work for this survey, education and the treatment. Okay. Now, the functions. So, the functions under this SET is detection of the cases early by house to house survey. Okay. So, this is the approach we are using here. The workers or paramedical workers or social health activists, they are going house to house, they are identifying the cases. Okay. So, by going house to house, they are checking the cases, providing the treatment, doing the contact tracing, health education about the leprosy. Okay. They will provide the free treatment, okay, of all the cases, will do the follow up, will do the contact tracing. This is what I told you already. Okay. Chemoprophylaxis is given in this leprosy, especially the first line drug means the dapsone is used here. Okay. After that, see, there is another concept of simplified information system, SIS. Okay. In all of the diseases or any infection, it is important to note cases. Okay. Now, we have started some computerized systems, we did some softwares we have to notify the cases. Okay. So, what is the concept here is the simplified information system, SIS, which is we have used for the management and information. Okay. It is an information system which is essential for the monitoring and evaluation of National Leprosy Eradication Program. And by this we are checking how many cases was in the previous time and how many we are on, okay, how many patients are taking treatment, how many have completed the treatment, how many are going for the follow up. So, this is showing that yes, whatever the programs we have launched time to time, they are actually they are actually successful. Okay, they are implemented well, and what the corrections we have to do for the next time. So, by this data we are checking. Okay. Now, what are the indicators means what data will take in this information, a simplified information system. So, the indicators here are, we will see number of cases, prevalence rate. Okay. So, how many cases, total cases of leprosy. Then after that we will see the incidence, how many new cases are emerging. Okay. So, new cases detection rate, this is also recorded in the SIS. So, we will see the incidence, okay, means new case. After that, child proportion among new cases, and all of the cases how many are in children group, okay. Then visible deformed case means I told you the grade disability, okay. So, visible deformed means grade 2 disability, the person is not able to see, okay. So, there is a functional disability. So, we will check how many patients are suffering with a functional disability, means this is how many patients had not taken the medications properly at the previous stages where we can prevent it, okay. So, visible deformed case proportion among new case. After that, multibacillary leprosy proportion, how many cases are there, because I told you leprosy is of two types, possy and multibacillary, okay. In multibacillary microbial load is more. So, we will check how many cases from all of these total are from multibacillary, okay. So, these are some of the indicators of the SIS, simplified information system. After that, other indicators we will see. So, few of them we have discussed in previous slides. After that, what are the other indicators? See, female proportion. So, all of the cases which we have noted or new cases we are talking here, in all of these how many are belonging from female, okay. Then how many new case detection rate in SC, scheduled caste, okay. Then how many new cases are detected in scheduled tribes, okay. They could be the vulnerable groups just because of the lacking of the information, or they are living in those areas where the facilities are not proper. So, the number of cases among these groups are important to take, okay. Then patients month blister calendar pack stocks, okay. This is showing that yes, patients are taking the medication. Proportion of health sub-centers providing MDT means how many facilities we have, okay, in a particular area which are providing the multi-drug therapy for the treatment of leprosy. This is showing yes, we have the facility, okay. Absolute number of patient made RFT released from the treatment. This is showing yes, the patient had successfully taken the treatment. They are out of this disease now, they are getting rid from this disease now, okay. Now, what are the newer initiatives under NLEP? So, see, National Leprosy Eradication Program, under this there is one plan, Focused Leprosy Elimination Plan, FLEP, which was launched in 2005. So, under this focused leprosy, our priority areas is on the prevalence. Our priority areas is to make the prevalence we are targeting those prevalence areas where the cases are more than 3 per 10,000. So, these are our priority, means this area will target, these area will be focused, okay, for treating the leprosy so that we can eliminate it, okay. This is I think now you are able to correlate why it is named as focused leprosy elimination program. After that, increased efforts on IEC. If we have such areas, on these areas we will implement our plan which was launched in 2005, and we are implementing here IEC, information, education, communication, yes. Will train the people and integrate the services, okay, train the staff members, trains the health professionals, okay, so that they can give the medication, they can check, they can screen the patients, diagnostic facilities they can use. So, we are using integrated service delivery. What we are doing? Week long block leprosy awareness campaign. So, we are also going for campaigns to spread the information. So, this is under your one plan. After that, there is another initiative, SAPEL and LEC. Okay, what is this? We will see. SAPEL means Special Action Projects for Elimination of Leprosy. Okay. This program was for rural areas. Okay, what you have to note? For rural area. Special Action Project for Elimination of Leprosy. After this, there is LEC, leprosy elimination campaigns. This is all for spreading the information, communicating the patients to improve the transmission of the disease, okay, to control the disease. So, LEC for the urban area. So, there is one difference, this is for rural, this is for urban. Okay. What we are doing here? We are covering the population who are residing in those areas, inaccessible areas where the people cannot approach of those of facilities. So, the difficult areas or inaccessible areas, okay, who are not generally covered by the regular program activities. So, this is also one initiative we did to eradicate the disease. After that, accompanied MDT. Okay. So, I told you what is MDT, multi-drug therapy. In this we are using the combinations like rifampicin, clofazimine, dapsone. There is one term called as accompanied MDT. It is little bit different. So, see what is the difference here in accompanied MDT. If any patient is unable to come or collect his or her MDT, multi-drug therapy from the clinic, okay. So, at that time what we did, any responsible person, family members or any neighbor, they can come and they can collect the medication. This is under your accompanied MDT, okay. They are designed for those patients who are from very far areas, okay, and they cannot come. So, to comply the medication, whosoever is knowing to that person, they can come. Designed to help patients who have to interrupt their treatment due to any avoidable reason, okay. Especially they are useful for irregular patients. Give patients a choice. By this we are giving the choice to the patients. They can means any neighbors or any the person who is knowing to that patient, they can come. So, we are giving the choice to patient here, and patients can collect entire MDT course when diagnosed after proper counseling. So, this is also we are doing by giving the proper counseling. We will give the choice to the patient. Yes, the patient can come and collect the entire course of the therapy. After that, there are indicators, new set indicators in the leprosy control. So, operational indicators. How will identify whatever the operations we did, are they successful, are they meeting in that manner which we want to, okay, which the government want to actually. So, operational indicators, we are monitoring the functionality of the these program, okay. What we are doing here, number of new cases detected, okay. This is showing yes, our operations are working or not. Therefore, we are seeing new cases only, not prevalence, okay. Then new cases with grade 2 disability. So, whatever we are checking for the new cases only or the grade disability, okay. So, new cases with grade 2 disability per 1 lakh population and how many had completed the treatment. In the set indicators also we have case detection indicators, okay. In case detection indicators, we will see how many children are suffering from this leprosy, because we are seeing the case, okay. We are seeing the classification of cases, how the cases are divided, how many females are affected, how many multibacillary cases are affected, how many new cases with grade 2 disability are affected, okay. So, with the name you can see the differences, okay, how the operational indicators are different with the case detection indicators, as the name is clear. Now, quality of service, how we will see the quality of service, okay, means how many have completed the treatment, how many are defaulters, okay, how many have the disability, new disability, okay. Similarly, we have epidemiological indicators. So, we will see the incidence here, means in the society what is the level or what is the condition of the disease. So, we will check the incidence here, we will check the prevalence. In the epidemiological, we have two terms, okay. In the population, we will see either the new case or all of the cases. So, then with the name you are clear like which indicator you will put in these of the different indicators. So, thank you so much everyone. I hope this is clear to all of you what is National Leprosy Control Program, and after that National Leprosy Eradication Program. Thank you so much everyone. We will meet in the next session.